channel. In this video, we are going to talk about what is Diabetes Mellitus. Oh, these are all of my teammates. Let's get started. What is diabetes? Diabetes is a chronic disease that affects how your body turns food into energy. If you have diabetes, it means that your pancreas cannot produce enough insulin or your body cannot use the insulin effectively. There are 3 types of diabetes mellitus. More than 95% of people with diabetes have type 2. This type of diabetes was only seen in adults, but it is now occurs increasingly in children. Approximately 5 to 10% have type 1, usually diagnosed in children and teens. Gestational diabetes occurs during pregnancy. These women and their children are at a higher risk of type 2 diabetes in future. Overall, diabetes can damage the heart, blood vessels, eyes, kidneys, and nerves.
Hello, let me show you what the symptoms of diabetes are. The symptoms of diabetes include feeling tired, thirsty, hungry easily, losing weight without trying, having dry skin, blurry vision, numb or tingling hands or feet, sores that heal slowly, more infections than usual, and urinate a lot more often at night. People who suffer type 1 diabetes may also develop symptoms like nausea, vomiting, and stomach pain. These symptoms can expand in just a few weeks or months and can be severe. Symptoms of type 2 diabetes are hard to spot and generally need several years to be noticed. Some patients may have symptoms like yeast infection on their skin, while some patients do not have symptoms at all. Therefore, it is important to know the diabetes risk factor. Gestational diabetes usually does not have any symptoms, but your doctor will conduct a gestational diabetes test for you between 24 to 28 weeks of pregnancy.
Causes of diabetes mellitus. Type 1 diabetes occurs when the immune system attacks and destroys the insulin, producing beta cell of the pancreas, resulting insulin cannot be produced. Type 2 diabetes more likely to develop if you are not physically active and are overweight or obese. Type 2 diabetes usually begins with insulin resistance, a condition in which muscle, liver and fat cells do not use insulin well. As a result, your body needs more insulin to help glucose into cells. At first, the pancreas makes more insulin. However, over time, the pancreas can make enough insulin and blood glucose levels rise. Genes and family history also can be the factors. Gestational diabetes is caused by the hormonal changes of pregnancy. Most pregnant women can produce enough insulin to overcome insulin resistance, but some cannot. Gestational diabetes occurs when the pancreas can't make enough insulin. Gaining too much weight during pregnancy may also be affected.
Diabetes mellitus not only reduces the quality of life and life expectancy, it is a major cause of several microvascular complications and macrovascular complications. For upper part of body, diabetes mellitus will increase the risk of getting stroke and also lead to loss of consciousness. We will suffer vision disturbance, cataracts, and glaucoma. We are always in a situation that extreme thirst and got sweet smelling breath. For the middle part of body, we will suffer fatigue and lack of energy, hyperpressure, pancreas malfunction, gastroparesis, excessive urination, and protein in the urine. Finally, for the lower part of body, we will suffer damaged blood vessel, ketoacidosis, nerve damage, dry, cracked skin, and food problems.
Hi, it's my turn now. I guess you are getting boring right now. Let me share something interesting to you. Malaysia is the sweetest nation in Asia. You know why? In every 5 adults, there's 1 diabetic patient. For your information, diabetics have 2 types of treatment, which are medical treatment and non-medical treatment. Insulin therapy and oral medication are commonly used to treat diabetes. Insulin slows down the release of glucose, block the carbohydrate breakdown, and increase urination. Oral medication increase the effectiveness and production of insulin, reduce the blood sugar production, and inhibit blood sugar absorption. Pancreas transplant is suitable for type 1 diabetes. It's either an organ transplant or just a cluster of islet cells. To prevent organ rejection, immunotherapy was developed. The parts in the immune system that cause illness will be turned off. Diabetes patients must also follow diet plans and increase their activities level to control their blood glucose level. Mediterranean diets and DASH diets are suitable for them. These diets are high in nutrients, fiber, and low in calorie and fat. Although diabetes risk factor like family history can be changed. Don't worry, adopting healthy lifestyle habits can decrease the chance getting diabetes. Promise me. Sleep well? Let me check who stay up late every night. Is it you? Eat healthy, sane, Now to McDonald's. Relax and get more active. That's all for me. Thanks for attention.